My name is Dr. B.V. Patel. I've been practicing here in Kenya for last 32 years, and we are practicing Limu Nursing Home started since 1980. This OBA program started since December 2006. After the OBA program started, before the OBA started, on an average, we are having about 4 or 5 deliveries in a month. But since the OBA program started, the number of deliveries start steadily increasing, and at present we have reached to 120 or 116 deliveries per month. Previously, before the OBA program started, I think it is a question of money, although our charges was not that much. For the normal delivery, we've been charging 5,000 shilling, but still people are having problems. And that is why they must be utilizing the government facilities more than the private one. But since the OBA program started, the things has drastically changed. Because of the OBA income, we have increased number of staffs because the number of deliveries increases. So all the staff, nursing staff, technical staff, and the other subordinate staff has increased in number of staff. We try to manage to increase some refabrication in the building to increase the space. Then we bought an ambulance for our things, and then accordingly the salary is also the staff has increased. So all these benefits is definitely due to OBA income. Being a private provider, we don't have the in-house gynecologist or the anesthetic here, and we have to call the anesthetic and gynecologist from outside, and depending on the cesarean sections, then we explain to them that this is the amount what we are getting. So we are dividing among ourselves how much is the operation theatre and how much the gynecologist is getting and anesthetic is getting. But since the last 2-3 years, because of the increase in the prices, everything, medicine, food-wise and everything, and the remaining rebate remains the same since 2006, which was fixed. So being a private provider, we are at sometimes in a loss, in a problem. Although turnover seems to be very much, but if we at the end we'll see that it is not that much which we are getting. If it is expand to the country, the other part, it will definitely more beneficial to the population in a whole. It's quite a good program. And since the OBA program started, the World Food Program is providing the food for the pregnant women also. That is quite a bit helpful. Once the pregnant lady comes with a voucher to us, we start her antenatal clinic. In the antenatal clinic, which is a normal blood examination and other things we do, she visits us 3 times for whole of the antenatal time. And when she delivers here, if it is a normal delivery, then it's well and good. We send the voucher to OBA, Voucher Agency, for the reimbursement. If during the time of antenatal, if she develops any complication related to the pregnancy, and if we have to treat that complication, then we send the separate bill for that one for the reimbursement, and then we get that money like that. No, since the OBA program started the initial phases, there was some delay, but then they have become more efficient, and then they are paying us quickly as possible. Now, previously we used to submit the claim at the end of the month, but now then we start submitting in the batches. So they also process in the batches and they provide us quickly. The maternal health in Kenya in general, it is good. The maternity death their government is trying their best to reduce it, and hopefully if everything works out well and the OBA expand the program to the other part of the country, that will be a very great help to reduce in the maternal mortality in general in Kenya. But this is overall maternal mortality is there in some remote area where there is a problem for reaching to the facility, or the facilities are not available. So in that cases they must be facing a lot of problems there. No, as far as the thing goes on, normally there is no problem, but when the complication comes, that is a big problem to them and burden to them, actually, financial burden, because once the complication comes, it depends again on what type of complication. Sometimes the complication is very serious and the mother can die also in that type of complication. But overall, what we have seen, that when the mother delivers in the house, most of the time they are not having much of the problem. But only when the complication, I have no idea exactly figure out what type of complication they are facing when they are delivering in the houses and what type of complications are there. But overall, if the facility is available, the things are better. It depends on whether who is conducting the delivery in the house. If they can get some qualified or experienced person to deliver, then the things are better as compared to there's nobody.
Yeah.